invite Aditi Iyer for her presentation. Aditi is a senior research scientist and associate professor at the Ramalingaswami Center on Equity and Social Determinants of Health in Bengaluru, part of the PHFI. Thank you, Aditi.
I have 10 minutes of time, and so, I didn't want to get into a lot of detail of methodologies and application of methods, but just focus on what I saw were the main takeaway messages from the work that I want to present. So this isn't really a presentation on one particular study, but it's reflections on what on the main theme, which is about the mechanisms and the processes of intersecting social inequalities in health. This is an area that Sundari flagged as being very important, and indeed that is the way that we probably ought to move forward if we really want to understand what drives inequalities and therefore what we can do about them. This is work that I have been doing over many years with Professor Geeta Sen, first at IIM, and continuing now into the new center at PHFI. So the question of why is it important to really delve with intersectionality, and why focus on mechanisms at all? So intersectionality is really a very challenging and dynamic field, because when you start looking at inequalities as they intersect with each other, you really start questioning and challenging the traditional assumptions that you go with into the field. So we all know from social theory and sociological and political science how class is expected to work, and one would assume then that caste works in the same way with health. So you would expect to have more access at the top and more exclusions at the bottom, and indeed that might be so. But if you start looking at class as it intersects with gender, then your assumptions and your conclusions about caste might start differing quite dramatically. So it's important then to look at inequalities intersectionally. But as we do this, we realize that the literature on what drives these intersecting inequalities is actually very thin, certainly in India and elsewhere in the world. So in this presentation, what we are really trying to do is to delineate what we see as three inequality-producing processes within households, drawing from our own research. So this isn't really research that's set out to understand processes and mechanisms, but because we approached the question in an inductive way and in an iterative fashion, we have some ideas on how these processes might work. And so it's really now at the level of hypotheses and preliminary suggestions for how it might work. And what we're arguing is that these processes actually vary quite dramatically at different points in the socioeconomic spectrum. So it's not one set of processes that drive all inequalities, but that they really differ very significantly at the top, in the middle, and at the bottom. I think this is an important point to keep in mind. So what are our sources of information? We've drawn on information gathered over many years, where we worked in Koppal in northern Karnataka. So one of the big sources of our, of the data that informed our intersectionality work was a household survey that we did in 60 villages. And we used, the data was collected in a very careful fashion to address issues of power within households. And so there were specific strategies on how do you give voice to people who have relatively less power in the household. And there were a number of strategies that we employed. I don't want to go into them right now, but we used that rich information to then do an intersectional analysis using the methodology that Professor Geeta Sen, Professor Chandan Mukherjee and I developed at the center in IIMB. And that methodology is both simple and efficient. It can be used for large quantitative data sets. The basic principles of that methodology is that you create intersecting categories, and then you can then, through a process of regressions and followed immediately by chi-square tests, you can understand differences between groups anywhere on a multi-dimensional socioeconomic spectrum, not just between the two extremes, but also any number of combinations of, pairwise. You can look at differences between groups somewhere in the middle. So we use this methodology to analyze the inequalities in access to treatment for long-term illnesses, but also access to education by children between the ages of 6 and 16. We also draw upon evidence that we gathered after the household survey on maternal deaths, and we did verbal autopsies, very detailed verbal autopsies of every single death that occurred in 67 villages over a 3-year period, and continuing after that as well. But for the purposes of this presentation, I just draw upon 3-year data. That again was methodology and an approach to verbal autopsies that differed quite significantly from conventional approaches, in that we recognize that when people report on deaths, they are doing so in a highly subjective fashion, and the reasons why maternal death reporting can be very subjective is a much more philosophical question that was addressed many years earlier by Akira Kurosawa in his film Rashomon, where 3 people saw a death or an incident in a forest and relayed that same incident in completely different ways. So it really speaks to a much deeper phenomenon, but we're really working with that assumption that it will be subjective, and therefore the need for triangulation is extremely important. The need for talking to a number of different people is necessary, and from that you can then extract and develop a very detailed timeline of events, because all events eventually contribute to the death. And from having done so, then you can really do a very detailed analysis of why the woman died in medical terms and what were the opportunities for death prevention, which is again a very different paradigm from the 3 delays model, which assumes that it's the delays itself that cause the deaths. So what we found was quite interesting. We found that when it came to access to purchased healthcare, gender interacting with economic class as defined very narrowly in terms of consumption expenditure played a very significant role in shaping the way inequalities were produced, but caste was not at all important. Caste became very important in the context of pregnancy. Caste and economic class became very, very important determinants of uptake of pregnancy care or even the experience of childbearing. And we also found that these social processes that produce these inequalities actually varied quite significantly. So the first point about the relative importance of caste in one instance versus the other really points to what intersectionality is, which is that you cannot make a priori assumptions about these different hierarchies, and that it's really context and time specific and outcome specific. So in terms of processes at the top, What we found, and all, you know, from the household survey, but that was, you know, very strongly reinforced by the verbal autopsies, was that what operates at the top is the politics of honor, where it's important for groups that are privileged to actually assert their authority within the prevailing social order, and that translates into the politics of honor, where it's women who are controlled, and the terms and the way and the terms of social reproduction are also highly controlled. So we found that, you know, in terms of access to healthcare, we found that it operated through the politics of the lack of acknowledgement. So women would be, you know, non-poor women would have very serious health conditions, and they would not think that it was at all important. It's largely something that is internalized within households, because the ability of the woman to express morbidity, it depends very much on the luxury that she has to do so and the time that she has to do this. Can she really take time away from work? You know, North Karnataka is not a place where there's a lot of wealth. So this is a disadvantaged context, and the relative differences between poor and non-poor people are not as wide as you would expect to find them in metropolitan cities or in more you know, affluent parts of the state. We also saw this in the context of childbearing, and because childbearing is very closely linked up with gender relations, we found that there were very tight controls over, you know, the ability of girls to make decisions about whether or not they get married, you know, whether they have a say in, you know, the decision making about childbearing, and it also then extends further to the extent to which they are able to express themselves when they are pregnant, and whether, you know, they consider their own ill health during pregnancy as being serious enough to merit any attention. In the middle of the economic spectrum, we've documented in a paper called the Leveraging Social Advantage to Overcome Disadvantage. So it's really, in the middle of the group, you have people who have a combination of advantages and disadvantages. And what they do then is that they are able to leverage their advantages in order to overcome the barriers that are linked to their disadvantages. And we find that it plays out, you know, in very clear ways in the context of access to health care. So you have poor men who are able to leverage not only household resources, but also resources outside the household in order to continue treatment. And that results in a process of gender bias rationing within the household. So poor women drop out of treatment because the men are appropriating the resources. We see it in education as well. So non-poor Dalit boys are sent and supported in their schooling to the same extent as upper caste students, whereas the girls are pulled out in order to take care of younger siblings or to you know, fill in where the mother cannot. At the bottom of the spectrum, in a very poor context where resources are scarce, there are very few resources in the poorest households. And in such households, there's no question of leveraging anything because there's nothing to leverage. And in such situations, we found from our work that it's the process of the perverse catch-up where poorest men fall down to the level of the poorest women. So, so really, so these are some initial ideas that are emerging from a reflection of our research over many years in one context and in the same set of villages. And I think, you know, it's important. I mean, we just want to put forth the idea that it's not just one type of process that's driving it, but there are multiple processes at work. This can, in fact, create a set of challenges in terms of policy, in terms of, empirical work. But the one thing that really strikes us is that, while caste may kick in one place or not, it's gender that works uniformly. It works in every context, in every situation, and with vis-a-vis every outcome. And I think that is really an important point to remember, that it's really a big driver of inequalities and when you see them intersectionally. Thank you.
Thank you, Aditi, for that absolutely fascinating presentation.